Hi, my name's Billy. I'm not a scientist, I'm not a medical professional, but as a concerned Scottish citizen, I took it upon myself to investigate the COVID-19 information that's been made available to the Scottish public. And this presentation is a result of what I found out. It's to try and put things in perspective, and it's to challenge the Scottish Government and the policymakers who are deliberately, in my opinion, keeping us in a state of darkness. In order to do this, I used the source material from the Scottish National Records website. And one thing to note, coronavirus deaths in Scotland are recorded in two ways. The NRS figures include all deaths that have been registered where COVID-19 is mentioned on the certificate. The Public Health Scotland figures, which are lower and only use those where COVID-19 is the underlying cause. I've used the NRS figures, which are higher. Now, we're being told that COVID-19 is the biggest threat that we've faced since the Second World War, so you'd think it would be a high-risk illness, but apparently it's not. According to the UK government, it was removed from the high category list because of the low mortality rate associated with it, and you can check this out for yourself on the government website. Also, you'd think that if it's the biggest crisis since the war, that the death rate would be the highest since then too, but it's not. It's the highest since 1993 and the 8th highest since 1974. The information regarding this is available on the weekly deaths spreadsheet on the NRS website, and that goes back to 1974. But in terms of yearly deaths in Scotland, 2020 was not unique. This graph gives a good visual indication of where 2020 was in comparison with all these other years since 1974. However, it doesn't tell the whole story because the population in Scotland is also higher now than it's ever been in the past. There's an obvious correlation between population and mortality. The more people there is, the more people die. The first graph shows the population changes in Scotland since 1974. And you can see a rapid increase from 2002. The second shows the ratio of deaths to population as a percentage. Normally, just over 1% of the population dies in Scotland each year. 2020 was no different. And if we take the percentage of people dying each year in relation to the population, 2020 becomes the 27th highest since 1974. Has Scotland experienced other epidemics similar to COVID-19? Yes. The coronavirus epidemic struck most severely between weeks 14 and 21 of 2020, recording the highest number of deaths in week 15 when there was 1,978 total deaths in Scotland for that week, 80% above the 5-year average. In week 16 there was also over 1,900 deaths and again an 80% increase above the 5-year average. In contrast, the mortality rates during the flu epidemic in the winter of 1989-90 were much higher. The two worst weeks occurred in 1989 when there was 2,125 deaths, and in week 51 there was 2,400 deaths, and that was 83% above the 5-year average. This table shows the data taken from the weekly deaths since 1974 spreadsheet that I've already mentioned. You can see that over a 10-week period, the total amount of deaths in 1989 was much higher than the 10 weeks of the coronavirus peak. There were 17,184 total deaths in the 1989-90 period, 10-week period, as opposed to 15,442 total deaths in 2020. Again, 2020 was not unique. This graph compares 2020 with the 5-year average and with 1989. The coronavirus peak is in green and it clearly shows that sadly a lot of people passed away during that time, and there was a very high number of excess deaths. But not all of them, as we shall see, died from COVID-19. You can see the first wave there. You can see there were a lot of excess deaths, sadly, at that time. The red dotted line is a 5-year average, and you can see that for most of the year, 2020 was in line with it. Along here you see a slight peak in November where there was a high amount of COVID-19 cases. And the blue line shows 1989 with the huge peak caused by the flu epidemic, which ran over into 1990. The question is, can anyone recall the seriousness of the 1989 flu, and how did the NHS cope that year? And why was it never reported in the way COVID-19 has been? Why was there no lockdown? Why were there no lockdowns? More people died in 1989 than in 2020. And the reason I'm bringing this up is because we're being terrorised with information that COVID-19 is somehow different and we need to be afraid. However, we've been through worse and no one even knew about it. COVID-19 has been responsible for a large increase in excess deaths, but at the same time there has been a significant decrease in other respiratory illnesses. 1,201 in fact, which begs the question, were they recorded as COVID-19 deaths when they shouldn't have been? At the same time, there was also an increase in non-COVID-19 deaths from other illnesses. In all, there were 6,704 excess deaths in 2020. If you exclude the decrease in respiratory deaths from the equation, then there was a total of 7,905 excess deaths for all other illnesses, including COVID-19. This means that 24%, almost a quarter, of excess deaths were unrelated to COVID-19. The fact that there was a relationship with the measures taken to combat COVID-19 and excess deaths is acknowledged by the Registrar General in Scotland. According to the annual review of demographic trends in 2019, there was a relationship between COVID-19 and the excess deaths and other illnesses, citing the following reasons. Deaths are due to unintended consequences of the non-clinical responses to COVID-19, i.e. lockdown measures. Deaths due to problems with health and social care service access. In other words, services were not available because the healthcare system was geared towards COVID-19. Deaths of individuals not presenting to health and social care services as they would at other times. In other words, people were scared by the incessant propaganda about COVID-19 to the extent that they were afraid to seek help. Excess deaths by location provides a clear view of the way that COVID-19 has been prioritised above all other illnesses. The spreadsheet Deaths Involving Coronavirus COVID-19 in Scotland, and its file name is COVID-deaths-data-week-50. I've used the spreadsheet up until week 50 of 2020, and it provides a graph showing excess deaths by underlying cause of death and location from week 12 up to the most recent, so up to week 50. But this graph demonstrates that hospitals have been monopolised to deal with patients from COVID-19 at the expense of those suffering from other illnesses. This graph shows excess deaths by location. Excess deaths are shown to the right in each location, and those to the left show where there is a decrease. The first one shows excess deaths in people's homes. The second one, care homes, and the third, in hospitals. So as you can see, 4,641 more people died in their own homes than normal, without the care and assistance they would normally have received in a hospital. There's no mention of these facts in Miss Sturgeon's daily briefing. Some odd statistics in care homes. 2,331 excess deaths attributed to COVID-19, but a decrease of 567 respiratory and cancer deaths. In total, excluding COVID-19 related deaths, there were 3,487 fewer deaths in hospital for all other illnesses. In 2020, hospitals were geared to supporting patients suffering from COVID-19 to the detriment of those suffering from all other illnesses. Another major factor in deaths caused by COVID-19 was that approximately 92% of those dying had pre-existing illnesses. Put another way, only 8% of those who died from COVID-19 were healthy and had no pre-existing illnesses. The table here shows the contribution of other types of illness involved with COVID-19 deaths from March to November. Sadly, it is the elderly and the infirm that are at highest risk from the illness. The younger a person is, the less at risk they are. In 2020, around 90% of those that died were older than 65. No one under the age of 20 died of COVID-19 in Scotland. In total, 640 people under the age of 65 died from the illness. According to the Registrar General's annual report, the population of Scotland was 5,463,300 in mid-2019. I'm assuming that it's going to be something similar in 2020. Approximately 60% of Scotland's population is aged between 20 and 65, which equates to 3,277,980 people. Based on these statistics, it can be calculated that a person in the 20 to 65 age group had a 0.02% chance of dying from COVID-19 in 2020. 92% of those dying had 92% of those dying had other illnesses. 8% of the 640, or around 51 people, were healthy and had no other illnesses. The chance of a healthy person between the ages of 20 and 65 dying from COVID-19 in 2020 was 0.0016%. In other words, 16 people out of 1 million. For anybody that's interested, all they need to do is Google efficacy of masks. There's numerous studies that show they have little value, and these high fashion cloth ones that everybody wears are next to useless. Anyway, in true absurd fashion, like many of the nonsensical rules they've put in place, they started a mask mandate after the peak had passed, when things were back to normal. They made no difference. When late autumn, early winter started, cases and death rates increased regardless of the fact that anyone was wearing masks. According to the Registrar General's 2019 annual report, comparing excess deaths rather than COVID-19 deaths avoids the problem of different countries recording COVID-19 deaths in different ways. Excess deaths are recorded on the European mortality monitoring website called Euromomo. It has been collating mortality rates for participating countries since 2015. Scottish data is available from 2017. The Z-score graphs provide the normalised range for mortality and show whether or not mortality rates are above or below normal. The following graphs show Scotland in comparison with Sweden. Scotland locked down, mandated the wearing of masks. Sweden didn't. The two graphs are Scotland's excess deaths with lockdown versus Sweden excess deaths, no lockdowns, in 2020. What's the difference? Well, the difference is obviously that the Swedes can go out for a meal with their family. They can have the next door neighbour in for a cup of tea. They can go to the gym. They can go for a pint. Can go for a haircut. Can go to the shops without wearing a mask. In terms of actual deaths caused by coronavirus, both countries are virtually identical. So much for the lockdowns. I just want to speak briefly about the NHS crisis at the moment. My own daughter-in-law is a nurse and my sister-in-law is a nurse, and I feel for them both. In fact, my own daughter-in-law has just recently contracted COVID-19 itself, so I sympathise to all these people. And there's no doubt that these poor NHS staff, doctors and nurses, are under pressure caused by the virus and the response to try and control it. And some reasons for this are staff absence due to self-isolation caused by positive testing to the virus, socially distanced and isolated wards with less beds, challenge of keeping COVID-19 patients and non-COVID-19 patients apart, significant PPE testing and extra process, an increase in seriously unwell patients due to halting and restricting healthcare since March 2020. And other pressures too, caused by the NHS not being equipped to cope in the first place. Prior to the COVID-19 epidemic, the NHS was already short of 4,000 nurses and 500 consultants, which makes you wonder why they spent a fortune building a Nightingale Hospital in Glasgow. They obviously knew they never had enough staff to work in it. The Glasgow Herald report on the 3rd of September 2019, Scottish Government told to get real about staffing crisis in the NHS. Official figures show the country is short of more than 4,000 nurses and midwives and more than 500 consultants. The Audit Scotland report in 2019 highlighted the dire financial position of the NHS Scotland. Without reform, the Scottish Government predicts that there could be a 1.8 billion shortfall in the projected funding for health and social care of 18.8 billion by 2023-24. What's the deficit going to be like now? Is this how we go about saving the NHS? The current situation. It is important to keep things in perspective, so I've compared the current state of affairs with some other years that have started badly in terms of high mortality. You'll note that 2018 was worse than 2021 so far. So we're currently in lockdown again with no end in sight. Surely things are much worse now. The table provides a comparison with 3 other years to put the current situation in perspective. Excess deaths lower than them. Again, nothing unusual going on. So what about the vaccine? I just briefly want to mention the vaccine, and my question doesn't relate to its safety or otherwise. Again, my daughter-in-law, who's a nurse, she's actually been vaccinated. My sister-in-law, who is also a nurse, she's been vaccinated. I'm not making any statements about the safety or otherwise of the vaccine. But the vaccine is presented to us as our saviour. the way out of this crisis, but they can't guarantee that it will stop you from getting the illness or passing it on to others. As has been pointed out in this presentation, for the vast majority of people in Scotland, the risk of contracting and dying from the virus is extremely low. 0.0016% of healthy people between the ages of 20 and 60. No one under the age of 20 died of coronavirus in 2020. That being the case, why do they need everyone in the world vaccinated against this virus? Rule by fear. It is clear from this presentation that things are not as bad as they made them out to be. That being the case, why have they never reassured us? Why did they never tell you that if you're healthy, you've virtually no chance of dying from this virus? Why do they never tell you that you don't need to be afraid, but rather they feed us constant propaganda to keep us in a state of fear? And the light at the end of the tunnel. Yeah. Well, we're bombarded with scare stories constantly, morning, noon and night. Every news programme, it's as if there is no other news. Constant TV adverts with smiley, happy people telling us to wash our hands and wear masks. Doom merchants telling us about new variants. All mainstream newspapers peddling the fear and advertising it. One young person suffering from the virus becomes headline news. Sad stories used to tug at our heartstrings. All of it aimed to corral us into the new normal with our sleeves rolled up, ready to take the jab. The new normal. This current lockdown means that we're being kept safe by the state in protection level 4. There are 5 protection levels in Scotland, the lowest being protection level 0. Is this our destination? At some point later this year, they will announce with mass celebratory propaganda that the battle against the virus is almost won, and we can all start living with the rules set forth in protection level 0. Is that what is meant by the new normal? If so, let's have a look at some of the things we can look forward to. Once we're in protection level 0, you can look forward to the same rules as you've grown used to when you've been protected by the rules in the other levels. You can go online and check them for yourself, but just 1 or 2 things you can look forward to. Maximum number of people who can meet indoors is 8, which can be from up to 3 separate households. You can meet people from other households outdoors in a private garden or in a public place such as a park or an outdoor area of a pub. The maximum number of people who can meet outdoors is 15, which can be from up to 5 separate households. If you're meeting people from another household in their garden and the gathering exceeds 8 people, you should only go into their house to access the garden. Do so quickly and without touching anything. Use the toilet. Avoid touching surfaces with your hands as much as possible. Wipe any surfaces that you do not touch with antibacterial wipes. Wash your hands thoroughly. Dry your hands with a freshly laundered towel or a paper towel, which you should dispose of in a closed bin. The maximum number of people who can meet outdoors in a restaurant, cafe, pub or bar is 15, which can be from up to 5 separate households. The list goes on and on and on. Protection level 0, the new normal. What we are not being told. Well, it's beyond the scope of what I've been presenting here to go into this, but there are literally thousands of scientists and health professionals who are opposed to lockdowns. Their voices are silenced by the mainstream media. There are plenty of scientific papers that dispute the efficacy of the lockdown approach. A visible example of where members of the scientific community oppose the lockdown approach is the Great Barrington Declaration, which calls for the most vulnerable to be protected while allowing the rest of us to get back to normal. The Great Barrington Declaration was put together by Dr. Martin Kulldorff, Professor of Medicine at Harvard University, a biostatistician and epidemiologist with expertise in detecting and monitoring infectious disease outbreaks and vaccine safety evaluations. Dr. Sunetra Gupta, Professor at Oxford University, an epidemiologist with expertise in immunology, vaccine development and mathematical modelling of infectious diseases. Dr. J. Bhattacharya, Professor at Stanford University Medical School, a physician, epidemiologist, health economist and public health policy expert focusing on infectious diseases and vulnerable populations. There were another 27 co-signatories, including Nobel Prize winner Michael Levitt and 2 from Scottish universities, Dr. Simon Wood, biostatistician and professor at the University of Edinburgh, and Dr. Gabriela Gomez, mathematician studying infectious disease epidemiology, professor at the University of Strathclyde in Scotland. And anyone can go to this site, and if you're a concerned citizen, you can add your name to the list there. As of the 31st of January, there were 741,951 concerned citizens. There were 13,540 medical and public health scientists who had signed it, and a further 40,962 medical practitioners. So what's the cost of lockdown? There's been a massive increase in national debt with a chance of total financial collapse, savings and pensions at risk, pre-pandemic £1 billion shortfall in Scottish NHS budget multiplied times over because of the measures taken to control the virus. Who's going to save the NHS when there's no money left? Businesses collapsing, bankruptcy, unemployment, people unable to pay their bills, social issues, increase in domestic violence and child abuse, increase in mental health issues, increased suicide, increase in Scotland's drug problem, currently the worst in Europe, increase in non-related COVID-19 deaths due to lockdown, unrealised impact of those not treated for other illnesses due to lockdown, our children, especially the poorer ones, denied access to education, cost of lockdown passed on to future generations. Here are my conclusions. The whole truth has not been told, and we are being ruled by fear. This has allowed those that rule us to establish a new set of laws and rules to be put in place to control us. This is happening all across the world, with the same psychological warfare applied. The virus has tragically killed many people, but its impact on society as a whole does not merit the unprecedented steps taken to control it. We need to wise up and realise that there is a defined direction of travel and the destination is dark. If you're concerned, write to your MP and MSP and make it clear that all protection levels must be removed and revoked when this thing is over. Stop watching the news and early morning propagandists. Finally, I'd just like to reiterate, I'm just an ordinary person who's concerned at what's going on. I hope this presentation has let you see that this virus is not as dangerous as it's made out to be. The real danger, as far as I'm concerned, is that our civil liberties and freedom are being stolen from us. Anyone can go to the National Records of Scotland website and find out all sorts of information. Please do, and don't just take my word for it. Thanks.